What is secondary hypertension in children? Have you ever wondered why some children have high blood pressure? It can be surprising, but secondary hypertension is a real concern. So, what exactly is secondary hypertension in children? This condition refers to high blood pressure that stems from a specific medical issue or external factor, rather than just being a mystery like primary hypertension. In children, secondary hypertension is actually more common than in adults, especially among younger kids. Blood pressure is the force of blood pushing against artery walls. When this pressure is consistently high, it is classified as hypertension. In children, hypertension falls into two categories: primary, which has no known cause, and secondary, which is linked to another health problem. Identifying secondary hypertension is important because treating the underlying issue can often bring blood pressure back to normal. So, what causes this condition in children? The most frequent culprits are kidney-related problems. Conditions like renal parenchymal disease, which includes glomerulonephritis or pyelonephritis, can lead to high blood pressure. Congenital kidney abnormalities and renal vascular disease, such as renal artery stenosis, are also common causes. Other factors can contribute to secondary hypertension as well. Heart conditions, like coarctation of the aorta, can raise blood pressure. Endocrine disorders, which affect hormone levels, can also be a factor. Certain medications and sleep-disordered breathing may play a role too. In rare cases, tumors like neuroblastoma or Wilms tumor can be involved. Interestingly, the age of the child can influence the type of hypertension they experience. In younger children, secondary hypertension is more likely. However, as children grow, particularly after age 10, primary hypertension tends to become more common. Regardless of age, any child with high blood pressure should be evaluated for potential secondary causes, especially if they show unusual symptoms. So, what symptoms should parents look for? Children with secondary hypertension may not always show signs of high blood pressure itself. Instead, they might exhibit symptoms related to the underlying condition. For instance, a child with kidney issues may experience swelling, changes in urination, or fatigue. In some cases, high blood pressure is discovered during routine checkups or evaluations for other health concerns. When a child is diagnosed with hypertension, healthcare providers will investigate for secondary causes. This process typically includes a detailed medical history, physical examination, and specific tests. These tests may involve blood work, urine analysis, imaging of the kidneys or heart, and sometimes hormone level assessments. Identifying and treating the root cause can significantly improve blood pressure control and overall health. In summary, secondary hypertension in children is high blood pressure caused by identifiable medical conditions, often related to the kidneys, heart, or endocrine system. Recognizing and addressing these causes is essential for effective management and preventing complications. Regular screening and careful evaluations are vital for children with hypertension, especially when symptoms suggest a secondary cause.